So welcome everyone. Very excited to be here. Some of you know who I am, but we'll have a nice, easy format here for today's session. So this is how to prevent falls and how to remain strong and independent on your feet. The format of the presentation is pretty simple. I'll give some introduction of myself and the team here and a little bit about why we're here and our general mission and aims. I would like to hear from you what concerns brought you in regards to balance to this presentation, so that we're sure to include some information that's pertinent to you. I'm going to go over some information that's helping you understand how balance systems work and how things are coordinated, and then provide some, if you will, general tips. Obviously, we're going to move towards expert advice. We've got some exciting things to show today and to consider using in our plans of care for those individuals that want to maximize their ability to move, whether they have falls, whether they have lower back pain, whether they have hip or knee pain. We've got this fancy schmancy device behind me that we'll talk a little bit about today. And the originator of that device is actually here today as well, so I'm really excited. So, for orientation, for those of you who are unfamiliar with the clinic, towards the front, if you go out towards the reception desk to the left, another sharp left is a restroom. If you need to get up and use that, by all means. On your clipboards, you have a number of things. Obviously, the first page, I think, is just folks in the community and surrounding communities who've had intervention here from some of our reviews. I believe there's a blank piece of paper in there for you to take some notes if you would like. There's also a couple other sheets. There's an envelope. We'll describe that a little bit later that entitles you to a complimentary discovery visit. And then there's also a form to fill out ahead of that discovery visit that helps us get all pertinent information for you. We'll describe that a little bit later. Is there anything else in that packet you don't understand? Did it cover everything? Awesome. So we'll get going. My name is Dr. Eric Kaler. I'm the founder of Physical Achievement Center. And this is the How to Prevent Falls and Increase Strength to Remain Independent and Active. So we help people achieve greater mobility and strength for their active life without medications, drugs, and surgeries. That's been our mission since the beginning. And we continue to advocate for that, even when nothing else has worked. So we liked working with individuals who feel stuck, unsure what to do next, or maybe haven't had the results they need. And more importantly, perhaps those that haven't even had a chance to hear all of their options. So that's pretty much why the clinic was started. A little bit about myself. I've been a practicing physical therapist of, I think, over 25 years at the point. And I had an opportunity to train at a high level as a fellow in the American Academy of Orthopedic Manual Physical Therapists, which is a mouthful. Basically, it just means that I had a chance to study in depth the clinical research and the clinical application of pain relief and movement science from head to toe. And I realized there's a huge gap between what's available for folks and what's possible, what's offered in the community. There's a wide range of reasons for that, but basically I became frustrated because I realized that my friends, neighbors, and family weren't being offered the best in the community. So I figured there was a space here to advocate for non-drug, non-surgical care to keep people strong and active. I am not of the opinion that people need to suffer needlessly, or as they add more birthday candles, subject themselves to not doing the things they enjoy doing and love doing. I'm having more birthday candles added to my cake every year as well. So I'm interested in helping people, making sure that they get the best out of what life has to offer. I wonder if maybe we hit the lights a little bit.
Yeah, that was actually my next question, to see if that would look right.
So I have a slideshow to keep me on track, basically, right? So I don't talk too much, right? So
there we go.
There's a clinical team, really proud of this team. There's a number of folks in there. Support staff is terrific. Some of you already interacted with some of them already. There's Robin in the back, way in the back, way in the back. There's Megan, who's in the room here. And then there's Kelly. I'll introduce some of the other clinical team as well. We'll certainly introduce Mr. Joe here in a little bit as well. He deserves his own introduction. So the bottom line is we want people to make better healthcare decisions. I'm really passionate about that because I'm a healthcare consumer too. When I go for consultations, I want to know not just what the doctor thinks, but what available options are available, so that I can make a good decision. That only makes sense because there's this thing called informed practice or evidence-based practice, which basically puts the patient at the center of healthcare. If you've noticed, compared to 30 years ago, the consumer is a little bit more closer to the center of healthcare, as it should be. We now have access to the internet, we now have access to lots of information sharing, and not that we're smarter than docs and smarter than the specialists, but we want to be educated in all available options. When we combine what we understand to be great options with the skill of the practitioner that can provide them, and when research supports that, when all of those match, that's a sweet spot. That allows us for a really good outcome, which makes sense. It's our preference, some research supports it, and the person in front of us knows how to implement that. Intuitively, that all makes sense. The challenge is, if you don't know all your options, how can you make the best healthcare decision? And that's what irks me when people tell me they're not offered options, right? So that's where we came in. So we've been doing public workshops like this since we opened. We continue to do this in a number of ways. We don't want to disrespect folks by saying silly things like, what do you expect? It's your age. Like, if you can't help somebody, just tell them, right? Or you just have to live with it. We don't find that acceptable. So, told you a little bit about myself. Dr. Rebecca is another clinician here with over 10 years experience. She's certified dry needling. She's got a fellowship in applied movement science, and she's helped a number of folks in the area. She was actually awarded the Physical Therapist of the Year in Wisconsin in 2019. Dr. Jessica is the newest member of our newest Doctor of Physical Therapy. She is enrolled in a fellowship program. She's certified in vestibular balance and dizziness. Jean is a physical therapist. She's specially trained in pain relief and sports recovery massage, certified spine specialist, certified upper extremity specialist. Cordy is a physical therapist who's got 6 years of experience. She's certified in pain relief and sports recovery massage, certified spine specialist, certified upper and lower body specialist. We value training to bring our patients the best that we can. Lori Shates is also here. She's got over 30 years of experience. She's a specialist in edema or swelling, and she has been a national teacher and mentor for that type of treatment program. We introduced this gentleman here, and just why you're here and what your role in this is today.
Well, first of all, I commend you guys for being proactive in the balance aspect, because the biggest issue, or the worst thing you can do if you have balance issues, is to not do anything. And because the less you do, the more likely your balance is just going to progressively get worse. Real quick, a little bit of history about this equipment. We've been around about 20 years. We sold the Atlanta Falcons, used it for Michael Vick's rehabilitation. We did a lot of sports enhancement, and it's probably about 2007, I was at a conference and I had all these therapists coming up to me talking about how great this would be for stroke, for hip replacement, for geriatric, for any kind of neural application. Honestly, like Larry, I'm an engineer for background, so I designed this thing, but really I've kind of learned as I went along, and I've learned a lot from some high-end people. We actually sell 15, I think we're up to 15 NICO facilities in the military, which actually works with brain injuries. One of our first systems was at Walter Reed Hospital when soldiers would come back from Afghanistan in their amputee department. So we've kind of evolved as we went along. Back in 2019, we sold a machine to NASA, and now NASA's training all their astronauts on this piece of equipment, pre and post. So before they leave, and their whole goal is to train them to see if they can't better acclimate them when they go to Mars. So it's kind of exciting stuff, but the most exciting thing is this system is here, and this is the only system north of Chicago available. So these guys are very highly trained, very smart and balanced. And to have this system as a complement to what they do is going to help you guys quite a bit. So that's, is there any more you want me to mention, or
That's perfect.
just a little background on what we do?
It's always good to know who's in front of you and what their skills are, so that you can, trust the person in front of you. They should have something better to say than what you can find on Google for sure. So we're gonna have some Google slides talk about the different balance systems and that sort of things here. And that will help provide the basis of understanding some of the features of this. I always like coming back to this myself because it helps encourage me to find creative ways to help people get better balance. And I don't think I've met a patient yet in all my 30 plus years that we haven't been able to improve their balance. And this is because of how the nervous system is designed, and we just provide proper stimulation. We have to figure out which are the limiting elements and then work from there. So the major part of the balance systems, and we'll put this all together at the end, there's a sensory motor system. So sensory motor is two words, sensory and motor, right? So we can sense things, and then our muscles can act and react to it. So our sensory motor system allows us to feel what's going on in certain parts, and sends information to the nervous system, our brain eventually, through our nerves. Our brain makes some decisions and calculations about what needs to happen for our muscular system to act. Fortunately, all that tends to happen automatically, so we don't have to think about that. We can think about important things like, where is Aaron Rodgers going to be next year? Or is it going to snow tomorrow? That sort of thing, right? We don't have to worry about our moment-by-moment movement. It relies on body felt sensation. It relies on input from the joints. Our joints contain receptors. Those receptors feed information consciously all the time. I'm going to have you do a quick experiment now. Look where you are. And I'm going to have you do this. You're going to raise your hand out in front of you with your comfortable shoulder, and then you're going to close your eyes, and then you're going to bend your elbow to 90 degrees or a right angle. And then once you open your eyes and look at your elbow, everyone is nearly a perfectly 90-degree elbow bend, right? They can't see that. You can lower your arm. The reason you can do that is because you've got felt sensors in your muscles and in your joints that tell you about the joint position. All those joints send information to the nervous system. It's a beautiful system, particularly in joints in the ankle, feet, and hips, and even in the upper spine. The skin also contains receptors. The bottom of your skin contains, I forget the calculation, maybe you know it, Joe, but millions per square inch of sensory receptors in the bottom of your feet, for instance. Muscles themselves have sensors. All these sensors are providing input to the nervous system. Individuals who are challenged in the sensory motor system might have a big difference between their feeling the stability on firm surfaces versus softer surfaces. What do I mean by firm surfaces? Firm surfaces like concrete, hardwood, thin flooring, industrial carpeting, versus shade carpeting, versus even grass, that sort of thing. So that allows you to get direct pressure in through some of those sensory receptors. Individuals who have stiffness in their hips, ankles, and knees might have a hard time with this system because those joints aren't working properly. So if those joints aren't working properly with proper flexibility, they're not providing the proper information to the nervous system or complete information to the nervous system. Our eyes want to fix ourselves in the world, right? So our eyes are looking for vertical and horizontal lines, right? So if I'm looking out at the world and I start to see some horizontal and vertical lines moving, I've either had too much to drink, or I'm moving, or I'm in an earthquake, right? So our eyes are always taking in that information to help us determine where we are in the world. It also detects movement. Yeah, everybody's, I think, had that experience. You're in the car, you're parked, and then the vehicle behind you starts to creep forward a little bit. You feel like you're going backwards, right? Well, you're receiving input from your eyes that's providing proper information to your nervous system, like relative to people, things around you, you're moving, but in actuality, you're staying still. So your brain's got to figure all that stuff out. So individuals who have perhaps difficulty with receiving input or processing input through the eyes might have a problem in crowds. Like maybe I'm okay, but when there's lots of movement going around, I can tend to get a little bit woozy. It's hard to process all that coming in. Or it's really difficult to focus if my eyes are closed. Those individuals become much more eye dependent because they start to rely less and less on some other systems, mainly that body felt sensation, and another system we're going to talk about, the vestibular system. Vestibular system, this is one of the funner systems. That looks like a snail, right? Something that you see in the bottom of the ocean, right? So the vestibular system is an organ that's contained behind the sensing organs for hearing in the ear. It's a very small organ. I've got a blown up model of that here. I'll pass this around. So it's got these, this is the system for the right ear. It's got these semicircular canals that are fluid filled. We can even take this off, and inside there's two parts. There's this part that has these semicircular canals, and there's this other part that looks like a snail. Well, this organ has heavy, thick fluid in it that also, on the inside, have little hair-like projections lined along the inside. When there's particular movements, those hair cells get stimulated, whether it's movement going forward, backward, up and down, or angulation of the head. These semicircular canals are perfectly balanced, right to left, to tell us about the speed and direction of head movement. So individuals that get spinning might have an issue with either A, that organ, or the nerve information, which is this yellow on this model, coming into the nervous system. These little bones here, just to give you an example of how big that is, everybody's heard they got 3 little bones in their ear involving hearing. This is blown up. These are those little bones connected to that same sort of system. So this is known as a vestibular system. So I'll pass this around. You can certainly take this off this platform. You can certainly look at that, play with that. I always like playing with little models like that. So we might suspect someone has a vestibular system problem if they have difficulty when they move their head. Like I could be sitting still, I can look up or down, and then I maybe start to get a bit woozy. It could potentially be a sign that something's going on. There's particular types of movement disorders that if you get really dizzy for a minute and a half to 2 minutes, and then it goes away when you change positions, it might be a vestibular system problem. Being up and down from lying down, those individuals, the world might spin a little bit or they might feel a bit woozy. And sometimes these individuals just can't seem to get steady. So you've got this organ that senses information, and then you also have that nervous system that sends information to the brain, and your brain's got to try to make sense of that. So some individuals, for instance, who are on certain types of medications, that nerve center in the brain can get a little bit damaged. So there's all sorts of things that can happen in that vestibular system. We want to be sure that when we look at individuals, we want to be sure to identify if any of those issues with the vestibular system are present so that we can specifically target that area. This next is an introduction to the Proprio 3000. We don't need to do this because we'll see plenty of this a little bit later on. I'll just say this. I saw this at a trade show about 5.5 years ago, and I really was intrigued by it enough to want to pursue it for the clinic here. We got to the point where we felt like we could acquire that, and I'm really excited that it's here. So we'll have a chance to see this working and how it integrates with our other systems of treatment in a little bit. So, we talk about balance issues and these different centers. So there's the body felt sensation, the sensors through the bottom of the feet, the joints of the ankle, knees, hips, joints of even the upper neck. We also have input that comes in through our muscle tissue, input that comes in through our eyes, and input that comes in through our vestibular system, or that inner ear system. So, question happens when we have a challenge with balance, can there be problems with more than one area? What do you think? Yes, typically there is, right? There's likely systems that are likely more involved, and maybe there's some that are less involved, but generally there's a mixture. there's rarely two patients who are exactly alike, right? Because everybody usually has a unique, different combination. We talked about a number of things. We're going to talk about how all this fits together, but almost always there's more than one issue going on. So as Joe said, that this device can be useful for folks, but it's most useful for folks when it's considered in the context of what's going on with that individual. We live in a very technological age. We live in a very informational driven age. You guys have lived that, right? That we see the advent of lots of information, lots of technology. Just having that information and technology doesn't necessarily lead to anything unless it's a wise application of it. This is where it gets fun. So how does all this fit in? So this is a pretty good illustration of it, I think. Everybody can see this fairly clearly? So at the top, this is how I visualize this as well myself. At the top is the central nervous system or the brain. We tend to think that the brain sends out information from the brain down to the muscles, the executing muscles, and that's what gets us our actions day by day. That's true, that occurs. Those muscles provide movement, which allows us to change positions. What's more impressive isn't necessarily the brain telling the body what to do. What's impressive is all the information on the other side of the chart. The other side of the chart, we talked about from the top to bottom, vision. We receive information through our eyes about the world. For instance, if you ever remember helping a child, a grandchild, learn how to bike ride, first thing we tell them, once they get the mechanics of it, is look up so that they can scan the horizon, right? So we use our eyes for a whole wide variety of things. When our eyes are kind of not working so good, that acuity goes down, or when some of these other systems aren't working so keen, we start to use our eyes a little bit more. There's the input from what I talked about in terms of the vestibular system, sensing the change of the angulation of the head, the movement of the head, forward, backward, up and down. Proprioception, that is the ability to feel yourself and feel joints and positions, just like you did that arm test. You could do the same thing with your foot. You could certainly pull your foot to a position of your choosing, and you'd likely get within that degree of motion because we have the ability to feel that in the tissues. There's mechanoreceptors, which are pressure receptors on the bottom of the feet. There's a wide variety of input into the sensory information. Kelly, if you wouldn't mind handing me that spine. One system that I don't even think is on the slideshow is what's called the cervicogenic input. This might turn on the lights for a moment. So sometimes we use fancy words that you gotta have fancy languaging to sound impressive, but cervical is just the neck. Genic is caused by. So there's something really interesting that happens. This is the base of the head. This is what we call the first neck vertebrae and the second neck vertebrae, so we properly label them C1 and C2. That's what we call them. There's a series of muscles, and there's just joints within this area. Those joints, when they're tight, when they're restricted, for whatever reason, whether it's just adaptation over time, whether it's due to some sort of injury, or who knows what, when there's problems in these areas and someone has dizziness or imbalance, we could take a look to see if that's a contributing factor. The reason that's important is because these sensory organs that communicate information to the brain from this area has a center, a nerve center that's right next to the same nerve center in which that vestibular system lies. So sometimes there can be too much crosstalk. There could be a problem in the upper neck and the body misperceives it as a problem in the inner ear system and causes balance. We have a number of individuals who have balance troubles who we go through an examination, and their systems aren't perfect, but nothing's really speaking to them. We look to this area. I just had an individual yesterday, tightness in that upper neck. We did some real simple, gentle activities with her. She got up, she demonstrated profoundly different balance reactions just because we treated her neck. So that's called cervicogenic. Yes, to the extent that that movement stays free. So there's about 3 or 4 different movements and positions in this upper neck that have to be relatively clean or smooth. But yeah, absolutely. The body likes to be in balance. So of course there are sometimes in some conditions there has to be much more that supports that than just that neck area. So that's kind of exciting for me because it's kind of fun because we can kind of intervene in areas that may not have seen some improvement in the past. And again, as clinicians, we can't be too focused. We can't just decide ahead of time that, Dolores comes in with this problem and we know it's this, right? We have to kind of test things because there's no one thing that just tells us exactly what it is. We have to go through a process to discover. So, in summary, there's lots for this to go right. We talked about this. The inner ear and balance centers have to work. The brain has to process the information. The muscles have to hold you upright. We didn't talk about the muscles yet, right? Question for you. Is walking enough to keep your muscles strong for your life? Who says yes? Listen to the question once more. Is walking enough to keep your muscles strong for your life? Just walking. No. It's not, right? Walking is a very efficient human activity. I'm not disrespecting it. It's not enough. Okay? If we were living in the mountains or had lots of hills and you walked hills, that might be a different matter, right? The muscles have to be very strong. For instance, I was literally going to a presentation on balance and I was carrying, I think my backpack and a table, and I was walking along the sidewalk and I tripped on a ledge in the sidewalk, a lip on the sidewalk, and I had to do this to prevent a fall, okay? So I had to, first of all, sense that imbalance, but my muscles had to respond fast enough for my leg to get in front of me, for that foot to get down, and enough strength to decelerate myself, otherwise I would have face planted, okay? So it's a reactive balance strength that is required in your muscles. So you can sense everything, you can process everything in the central nervous system, but if the muscles aren't strong enough, it's tough to have the muscles do their part. We had an individual on this device earlier who she was complaining about ataxia. She had a stroke and she had some muscle jitteriness that is present in her legs. Her legs are weak, right? Got her on a setting for this to stimulate those muscles, and I was shocked at how much better she walked afterwards. Just by stimulating those muscles and getting those muscles a bit tuned up. The joints have to be flexible. We find that as birthday candles are added onto cakes, there seems to be increased tightness in the joints. It doesn't have to be that way, but that's just the way it is. Your ankle flexibility, there's only 15 degrees to 20 degrees beyond a right angle that your ankle can really bend. It's common for individuals in their 50s, even especially 60s and 70s, to have only 50 or even 20% of the available motion in their ankles. Your ankles are a very important action because there's this ankle sway. You can envision I'm standing on a boat, right? Or even in life. We sway a little bit all the time. If you don't have enough flexibility in that joint, there's not proper information coming from that joint, and that balance system is going to be challenged because there's not the right information. Talk a little bit about the necks, hips, and pelvis. There's also a pelvis sway. We also, as we do things, we want to reach. We use our pelvis to counterbalance. So that tightness in our hips, absolutely, that's related to balance. And then we talked about the muscles needing power to react. Muscles can't be strong enough, right? So, questions about that? Comments? There's a lot there, but here's a couple of common. You have one? Okay. So this is kind of general advice, general strategies, how to get better balance and avoid the next fall and remain independent. So basically, how to stay balanced. Well, on one end of the spectrum, you can stay safe and not do much. You can sit on your doof and not be all active, but that isn't much fun. You can also live life, right? And there's a balance to play there, right? If you sit too much, that's not good. If you go and do things that are a little more active, then your body needs to be ready for living that life. That's a little bit more active. So we talk about skiing, downhill and cross country. Maybe it's waterfall tours. Maybe it's playing with the grandkids in the backyard. Maybe it's trying to get up and down the bleachers from sporting events when you visit family activities. One piece of information, if you're noticing that when you're walking by something, you need to hold on to the wall or a piece of furniture, we call that furniture walking. Not a great idea. Okay, if you're finding that you're walking around and you're having to hold on to things as you move by them, I want you to be safe. I'm not asking you to be unsafe. That may be a clue that your balance is problematic. And instead of furniture walking, you should find, do you need a device that keeps your body center of gravity, which is basically behind your belly button over your feet, because otherwise if you do stuff like this as you're walking by it, your brain will get confused because it doesn't find that center point and your balance will deteriorate over time. So if you're furniture walking, consider another strategy, whether that means a device, get some balance training, so that you can walk more naturally without having to lean onto something. Remove slip and trip hazards. The big key is sit when wet. Is there a really reason to be standing in the shower if you feel your balance is impaired? Probably not. It's just going to add risk unless you absolutely know for certain that you've got a slip-free surface. One of the first patients I ever treated was the strongest individual. He's a power lifter in the U.S. Navy. He looked like just the most massive bodybuilder guy you've ever seen. He was in a shower, slipped, grabbed the ceramic holder, that dislodged, he ended up cutting his triceps. His arms were bigger than my legs, right? So he was one of the strongest dudes on the planet. He was in a shower, he slipped. If it can happen to him, it can happen to anybody, right? So sit when wet. This is another tip, sit less, move more. Being up and active on your feet does stimulate your receptors in your feet, ankles, joints, and it stimulates your brain. So if you're finding you're sitting for extended periods of time, and I know there's individuals here who enjoy reading, that's great, but you need to get up and move more often. There's individuals who enjoy television, that's great. Get up at commercial time, walk around, get your body stimulation. We are not made to sit for extended periods of time. We look at Google, and at the time I produced this slideshow, there was 1.2 billion hits for balance exercises. Okay, and some of those may be appropriate for somebody, but there's a lot out there. Like, what are you going to consume and what are you going to do on a regular basis? What's adjusted to you and how are you going to adjust that over time? That's where the expert help comes in, because we can help decide for you what's the most effective and efficient activities to do. More importantly, then how do we progress it? In balance training here, we start with a series of exercises. We very quickly move on to more advanced exercises, because just doing this isn't going to keep you safe in the community, right? Certainly we want people to be able to stand independently on one leg, but that's not enough to stay safe when you're out in the real world. So, what do we do here at Physical Achievement Center? Because there's so many things that could be contributing to balance trouble, we take time to listen to your story. We want to do an individualized examination. There's a number of different balance tests that we can use, but we want to prioritize based on what symptoms that you're having to figure out what we need to do for you, rather than just running you through a whole bunch of tests that don't have as much meaning. We provide individual recommendations and treatments based on what's presented in front of us. Some people need some more strengthening, some people need some vestibular training, some people need some treatment to their neck. You get the idea, right? It has to be individualized and personalized. So a good time to consider consulting with Doctor of Physical Therapy for your balance is when your balance or weakness has increased more than 10% in the last 1 to 3 months. If you've fallen even once or nearly fallen while doing everyday activities, right? If you've fallen once, what does that predict? The possibility of another fall, right? You want to avoid that. Pain or stiffness keeps you from doing your favorite activities. I'm talking hip pain, or stiffness, knee pain, ankle pain, spinal pain. If your spine is so stiff that you can't get to an upright position, that's going to affect your balance as well. And there's maybe opportunities to intervene quite a lot to get your head more upright over your base of support. And when imbalance prevents you from feeling safe at the times of the day that are a little more challenging. If you got to get up and go to the restroom at night and you feel quite unsteady, right? Your nervous system is in kind of sleep mode then, and perhaps towards the early part of the day or later part of the day, If you're having more trouble in balance at that time, it just means your balance needs a significant tune-up. And then feeling imbalance keeps you from standing more than 30 minutes or walking for more than 10 minutes. Basically, people who have balance trouble know they have balance trouble, right? It's they have that fear, and that fear is usually the body's way of telling you something isn't quite right. And of course, if individuals are fearful of losing their independence, who wants to not be as strong next year as they were 5 years ago, right? So, in physical therapy plans of care, we'll get on to this device here pretty soon. We can provide pain relief and loosen up joints through mobilization and manipulation techniques. So those stiff ankles, within a session or 2 or 3, we can free those ankles and stiff joints up and the hips so they can move better, so they can report better information in the nervous system. For muscles that are tight and sore and painful, we can provide deep massage work to get them relief so that those muscles can respond more appropriately to balance and in themselves naturally get a bit stronger. We pride ourselves in developing individualized, that is individualized to that individual, exercise prescription for muscle building, muscle strength and development. Walking's not enough. Walking's great. Do some of it, but your muscles need to be stronger, and walking isn't going to get it there. We want to develop a strength program that involves whole body strength training to get you back to easy sit to stand, up and down from the floor if that's one of your goals, in and out of a car, and up and down stairs. We can provide some pain relief through dry needling. There's a very effective protocol for those individuals that have some of that neck-induced dizziness, doing some hands-on work and loosening up that upper neck in addition to some dry needling, which is the use of acupuncture needles. It can be very helpful to help in that cervicogenic or neck-caused dizziness episodes. The reason I'm excited to drive to work every day is precisely this. Modern-based physical therapist provides the best in non-surgical, non-drug care to keep people active. So with that, maybe turn on the lights. What questions do you have? Turn on them a little bit. Let your eyes adjust. Yes?
So do you think you could help with my dizziness? I mean,
Absolutely. Yeah, absolutely. So what we're going to do, yeah, absolutely. So what we have an opportunity to do is to get 100% confidence in understanding what's going on in your circumstance. That's why we offer people the opportunity to come in for an individualized assessment so we can be certain what's going on.
I know they can because they help me.
okay. I'm sure you probably could, but.
For sure. So what we'll do now is Joe is going to accompany someone on this device. We're going to show how this works and how it's integrated with the balance programming here. And the next thing is I need somebody who's like eager to get on this thing, right?
So, come on up. So, the idea of the Proprio is actually to kind of break apart balance, look at the different aspects of balance, try to help them decipher what part of the balance needs to be fixed. So there's 2 separate tests, and then there's some other training protocols that kind of identify different things. We're going to put this on. And so basically this has a sensor. These reflective markers will measure the core movement. If you pull that around and pull it tight. In the back of the equipment is a camera system, so this will be able to measure her core movement. The generic definition of balance is your ability to maintain your center of mass over your base support. Eric could kind of refer to that. So our goal is to actually determine or to see how well a person can maintain that center of mass over base support, see what kind of compensatory strategies or what kind of strategies they're using, and then they'll kind of help identify if there's any residual things happening outside of what you think the diagnosis may be. So go ahead and hop on. I'm going to start with what we call
All the way up here?
Yep. And then turn around and face me. Did you want to put the harness?
Yeah, so everybody's got different levels of balance and confidence. So what we do for most individuals who have significant balance impairments, we have a safety strap here. So you'll see that, and this device also tilts down to enable someone to have a much lower step. If you don't mind, grab those two straps. Thank you. So individuals in here, very safe. Oh, we have to spin that a little bit, Jim, sorry. You'll see why this is helpful, because it allows us to keep that person confident and safe. There's not a lot of places for them to go. There's a backstop here, there's two arms.
That's all right, there's plenty of people in there.
Oh, do you see where the other?
Oops, you can take this over there.
It's all yours.
So it looks a little intimidating for some folks to get up there, but that front can tilt down. And we haven't had anybody who hasn't been able to be successfully on that.
Thank you, sir. You're going to be John Doe today? Okay, so this first test is called the Proprio test. Proprio test is a standardized 2-minute test. If you don't mind holding on to the rope. It starts off very slow, and over 2 minutes it ramps up in both speed and degrees. There's a couple things that we kind of test through this, but I won't tell you what it is because I don't want you to know yet. Okay? And they're going to, no, they're going to find out. So we need shoulder width apart. There is no pass-fail on this test, okay? Basically what we're doing is we're measuring your ability to maintain your center of mass over your base support as it progressively or you start getting more functionally challenged. So we're kind of going to stress you out a little bit and see how you respond to it, okay? So go ahead and hold on to the rope.
Both hands?
It starts off, yes, it starts off very slow, okay? At any time if you want to stop, you just hit this button or you let go of the rope, I'll stop it. Are you ready?
Yeah.
Look straight ahead, and we go. So this is going through random movements. She has no idea which direction it's going, so she has to respond to this.
Did you see okay?
And this would help when I ski, because you're changing.
You being a skier, you should do really well on this test. And it is true because as a skier, you learn if you don't maintain your center of mass over your base support, what happens? Yeah, you get a lot of snow on your face. So skiers are naturally very good balance and actually you're doing really well. Now, a lot of patients, they may have stopped by now. It's fine. It doesn't matter how long you go. Of course, the goal is to try to make it the full 2 minutes. But the test score is based on the amount of movement that she has over the time period that she's on the equipment. She's ready for the slopes.
I feel it more in my toes.
You do?
Yeah.
Okay.
And yeah.
So that's interesting. So basically, as you mentioned, you got the receptors in your feet.
Mhm.
When you start going up on your toes, what you're trying to do is
Compensate.
stimulate those receptors and trying to get more somatosensory input from your feet.
Mhm.
So that's kind of interesting. I wish I could stop it. So I'm not going to go through this, but she scored a 393. That's outstanding. Actually, that's outstanding. Perfect score is 0. So nobody ever gets a perfect score because nobody can stand there perfectly still for a full 2 minutes, okay? The worst score you can get is 1,440. The average score probably for a person your age will be probably around 900 to 1,000. Probably people here would probably be more like, I'm not saying you guys, people who are coming for balance issues would be between 1,000 and 1,200. So this is an outstanding score. Not saying that it could be better, I score better than you, so you can always get better. But this kind of shows her weight shift is really good. It's evenly distributed across the center line. So that's outstanding. Wow, that's tremendous. So what we try to do, I talked about the 2 different aspects. Number 1 is her reactive balance. How well can she respond to unforeseen circumstances? If you're walking across the field, you step on a rock, how quickly can you respond to that rock to prevent from falling? If you're walking along and there's a curve there, if you see that curve, you pre-position your body, take a step down, it's no big deal, right? If you're walking along and you don't see that curve, all of a sudden there's a change, your ability to respond quickly, that's something that can be trained and improved, okay? She's a skier. So when she's skiing, she's going downhill 100 miles an hour, she has to be able to respond to these bumps as she's going across them. So she is actually training on the Proprio out on slopes. Now it costs you a whole lot more money to buy tickets.
Yes, they go
I know
up
that
terribly
they're coming in here,
price.
but I know it's crazy. But that's why she did so well. The body kinematics is the second thing we look. How is she responding? Does she have sore hip, bad back, hip replacement, an ankle sprain from 30 years ago? You'll see compensatory strategies that if they weren't rehabbed properly 20 years ago can carry over. Now, if she was shifted over and rotated around, she's putting added stress on joints that's going to cause pain as we get older. Those things need to be corrected. So pains that you're having now could be residual effects from something a long time ago. And so we can actually see how the body kinematics doing and then be able to correct it, okay? We're not going to go too much in details, but there's other strategies that person has to learn as you get older. He talked about the rigidity in the body. When an elderly person starts falling forward, they tend to go forward with their trunk. Okay, the normal or proper automatic response is as you go forward, you pull your shoulders back. Or if you start going backwards, you pull your trunk forward. Okay, if you start going sideways, you pull your trunk around, pull yourself back. These are automatic responses that as a person gets older and they become more rigid, they don't have those. So breaking rigidity, trying to work on body controls, there's a whole compass of things. So now that we've done this baseline, which is tremendous, we don't really have to work with you on this aspect. But as they progress, you want to be able to kind of start working on these different aspects. And if you can identify exactly what's wrong, they can isolate and they can say, okay, we're going to focus on these areas that need help. Because if you focus on the somatosensory system and it's a vestibular issue, your vestibular system is going to get worse, and vice versa. So knowing the appropriate system to be able to concentrate on is going to make a big difference. And these guys will have that expertise to be able to identify it. You want to do the other test? Because you did so well. We'll do an abbreviated version, but we're going to come up a little bit. That's good. Okay, pull this foot up just like, okay. Go ahead and put your hands to your side. I'm going to start this test. It's real easy. It's just going to go forward and backwards, very slow. So as it goes forward and backwards, just stay upright. Don't fall down.
Will this thing
Is that
catch
all?
me?
You won't fall because it'll keep you within the sway envelope. But I'm here just in case. Okay, you ready? Look straight forward. So I'm going to talk a little bit while she's doing this, so just sit with me. But the platform is moving at what Erica described, this natural body sway. So if I close my eyes, my body's going to sway at approximately 4 degrees per second, which is the speed at which this is going, okay? Pretty easy, isn't it?
Mhm.
Okay, it's pretty easy because she has her eyes open. Everything's easy with your eyes open because we all become very visually dependent, that we ignore the other systems and utilize our eyes to keep our balance, okay? That second that your vision starts getting worse, or you wake up in the middle of the night from a sleep and your body's weakened, that's when the problem comes. So we're going to do the second minute with her eyes closed, and she's not going to like me after that. So you like me now though, right? Now you won't after this.
Really?
No, it's not that bad.
So when do you want me to close them?
As soon as I have to enable stage. Okay, you ready? I'm here for you, so don't worry. And close your eyes. You did really well.
Wow.
That's fine. That's fine. You're good. Grab hold if you need to. Okay, we're just gonna stop it. Just not because she can't do it, because she can, but just for time purposes. Substantially harder, isn't it?
Yes.
Close. It was so easy. It's just going real slow. There's no big deal. And she stands upright. You close your eyes. All of a sudden, you're forcing your vestibular system, your somatosensory system to say, okay, what's going on? I have no idea. And you start seeing this like a little bit more inverted pendulum type movement, okay? These systems can be trained. The reason why they get worse as you get older is 2 reasons. Of course, there's a little bit of deterioration in the vestibular system, but there's also the inactivity as you get older. You sit on the couch more, you don't do as much physical activity. These systems don't get trained. So the great thing about being at a place like this is you're not on your own. You're harnessed in, you have a professional that's there that can kind of identify these things and then start putting you through training protocols to make you better. And the only way to get your vestibular system better, the only way to get your reactive balance better, the only way to get all these things better is repetition over and over. The neat thing is, the great thing is, it takes a while for them to get worse. It doesn't take that long to get better. So in a short amount of time, they can do some vestibular and somatosensory training, get you substantially better. You can come back 6 months later and you'll still show a lot of that improvement. We got some research to show that. Research. That's all I'm going to do for now. But I just showed you the testing portion of it. There's also the training portion of it, actually taking the information that we've gotten from the charts and from the test and taking it to the next step to decide what we need to do to make those areas better and improve your balance. Any questions?
Do you use this with people who have like Parkinson's disease or something like that?
So,
Training?
I'll tell you, it doesn't matter what kind of neurological issue you have, Parkinson's, MS, stroke, balance is affected on all these things. So in addition to doing the other things that they may do for those different diseases or diagnosis, you should also look at the balance aspect because, you know, you've got the Parkinson's, you're trying to solve the Parkinson's, you have the drugs that you may have to take for different things, but then you fall, which wasn't your Parkinson's, is the balance portion of it. So being able to simultaneously, as you're going through different rehabs and working on balance, is also a very integral part of the whole rehabilitation process. Correct me if I'm wrong, or actually, whatever I say. I'm just an engineer. right? We don't know.
Engineers are awesome. They really are. So I'm delighted that we didn't script that part of it together, right? In terms of that messaging, but I can assure you that messaging that he just said, it doesn't matter if you had that problem for a long period of time, it can change. And it's not necessarily just because of us, it's because of the brilliance of how our nervous system is designed. I am still impressed that over 30 years of doing this, that the sort of changes that can happen in the nervous system, no matter how that nervous system is challenged. Think about it this way, when I first started physical therapy, what did we believe? You have a certain number of brain cells at 18, and in Wisconsin we drinking a high number of those away, and they don't come back. Right? Right? That's what we believe, right? There's this thing that then we understand. We grow more neurons. We know that because they took brain studies of people who have terminal cancer. These are some of the most sick individuals. And they take serial imagery of their brain, and they find they sprout new brain cells. That is exciting because when we stimulate folks, whether we're doing this type of work, whether we're doing hands-on type of work, we're lighting up that central nervous system. We're stimulating that nervous system, and we will not catch up to the brilliance of that nervous system. In my lifetime, I don't believe, right? We can start to improve and understand it, but just because it's been around for a while, whether it's a stiff ankle from an old fracture or injury, whether it's tightness in that hip, you get that thing moving a bit better, all of a sudden that nervous system starts to fire better. And that's what's really exciting. So, again, there are some things that are going to happen for certainty as we get older, right? Tissues will tighten up a little bit, right? But that doesn't mean that we can't adapt and improve, right? So that's the important thing. So we see it all the time. So if you're willing to even suspend disbelief for a period of time, or prove it wrong, right? Like just trust the process. I appreciate that. So.